Listen up, because this video is really important for anybody that's had kids, is currently pregnant, or plans to have kids, or even those that take care of women that have been pregnant. So that's basically everybody in healthcare. How many of you think that after you have a child that it's normal to have lower back pain? Fun fact, back pain is not normal. Brittany Mahomes posted on her Instagram story that she had a fractured back and she warned women to take care of her pelvic floor. I'm going to explain why I think Brittany suffers from lower back pain and why she posted this story. As you probably know, Brittany is married to NFL superstar Pat Mahomes, and they have 2 small children. If you didn't know, Brittany is also an athlete and was a standout in high school and college soccer. So what does that have to do with her broken back? My best guess as to why Brittany posted she has a broken back is most likely she has pars defects. The pars interarticularis is actually a part of our vertebral body, and stress fractures in our lower back are called pars fractures, and they're very common in athletes, including soccer players. My best guess is that Brittany suffers from pars defects, which she may have sustained in her soccer days. Not only do we see it in sports like soccer, football, and cheerleading, but we also see them as degenerative conditions in the spine as well in non-athletes. So let's get to the point about her pelvic floor. We rely almost exclusively on our deep core muscles to help support our back, and this particularly is important in patients that have back injuries like pars defects. Our deep core muscles includes the multifidus muscles, which are muscles that support the lower back as part of our posterior chain, our transverse abdominis muscles, which are the muscles in our abdomen, our diaphragm that helps with breathing, as well as our pelvic floor. Remember, Brittany has 2 small kids, so she has been pregnant twice in the past few years, and pregnancy can stress our deep core muscles to the max. It stretches our muscles of our abdominal wall as the baby grows, as well as weakens our pelvic floor, particularly during delivery. We compensate for that using our back muscles during pregnancy, where you get a little bit of a hyperlordosis, as well as stretches our diaphragm because of the growth of the womb. All of these muscles are put at max capacity during pregnancy, and if we don't work on strengthening them afterwards, you got it. Lower back pain. You can't expect to go through 9 months of pregnancy and have all these muscles stretched out and then just to spring right back into positioning right after the baby is born. We have to work to get them tight again, because if you don't, your back has no support. Not only will this cause lower back pain in young women, but as they age, it can accelerate degenerative disc disease, as well as cause pelvic floor issues like incontinence. I mean, how many of you guys sneeze and have a little bit of leakage of urine? That's because your deep core muscles are not trained appropriately. So let me end with this on a few tips of how you can improve your pelvic floor and your deep core health. Work on strengthening your back and your diaphragm by exercises like the glute bridge. I love glute bridges for core strengthening. And if you want to kick it up a notch, try marching glute bridges. Other great exercises for the deep core include the bird dog and the dead bug, and you can easily look up videos on YouTube as to how to do those exercises correctly. Bowel habits and diet are extremely important to maintain good bowel health, and think about toilet positioning as well. The squatty potty is awesome to help keep your bowel and back happy. Lastly, diaphragmatic breathing is so important for your pelvic. Most women know that Kegels exercises can help improve your pelvic floor strength, but I am always surprised as to how many do not know about diaphragmatic breathing. Here's a brief explanation as to how you can do that. As you inhale, allow your belly to expand. That allows your pelvic floor to drop and lengthen. And when you exhale, your diaphragm releases, your pelvic floor shortens and moves back into resting position. Basically, your diaphragm and your pelvic floor are working opposite of each other. During inhalation, the diaphragm contracts and your pelvic floor releases. And during exhalation, your diaphragm releases and your pelvic floor contracts. So thank you to Brittany Mahomes for bringing light to this very important topic in women's health.